Evening. Today we will discuss tape use of medication in hospital. Now, what are medication errors? The administration of the wrong medicament or dose of medication is called as medication error. There are various types of medication error. It may be prescribing error, omission error, wrong time error, unauthorized drug error, improper dose error, wrong dosage form error, wrong drug preparation error, wrong administration technique error. Deteriorated drug error means administration of a drug that had expired or for which the physical or chemical dosage form integrity had been compromised. Monitoring error, that is failure to review a prescribed regimen for appropriateness and detection of problem or failure to use appropriate clinical or laboratory data for adequate assessment of patient response to prescribed therapy. Compliance error, inappropriate patient behavior regarding adherence to the prescribed medication regimen. Other medication error, any medication error that does not fall into one or above predefined category. Now moving on to the audit of medication errors that are drug product nomenclature, equipment failure or malfunction, illegible handwriting, inaccurate dosage calculation, inadequate trained personnel, inappropriate abbreviation used in prescribing, labeling error, excessive workload, medication unavailable. Now moving on to the ASHP guideline to prevent medication errors, that is organization and departmental recommendation may be used in the principle of the formulary system, the PNT PTT committee or its equivalent composed of pharmacists, physicians and nurses or and other health professionals to be responsible for formulating policies regarding the evaluation, selection and therapeutic use of drugs in organized healthcare setting. Care and consideration must be given in hiring and assigning personnel involved in medication, ordering, preparation, dispensing, administration, and patient education. Sufficient personnel must be available to perform tasks adequately. Suitable work environment should exist for the preparation of drug products. Now moving further to the organizational and departmental recommendation that the pharmacists and others responsible for processing drug orders should have a routine access to appropriate clinical information about patients. The pharmacy department must be responsible for the procurement, distribution and control of all the drugs used within the organization. Except in emergency situation, all sterile and non-sterile drug products should be dispensed from the pharmacy department for individual patients. The pharmacy director and staff must ensure that all drug products used in the organizational setting are of high quality and integrity. The use of the patient own or home medication should be avoided to the fullest extent possible. Now moving on for the recommendation for prescribers to determine appropriate drug therapy, prescribers to stay abreast with the current state of knowledge through literature review, consultation with pharmacists, consultation with other physicians, participation in continuing professional education programs and other means. Prescriber should evaluate the patient total status and review all existing drug therapy before prescribing new or additional medication to ascertain possible antagonist or complementary drug interaction. In hospital, prescribers should be familiar with the medication ordering system, that is the formulary system. Drug order should be complete. They should include patient name, generic drug name, and trademark name. Moving further, when possible, the prescriber should talk with the patient or caregiver to explain the medication prescribed or any special precautions or observation that might indicate, including any allergic or hypersensitivity reaction that might occur. Prescriber should follow up and periodically evaluate the need for continued drug therapy for individual patients. Instruction with respect to hold orders for medication should be clear. Now, what are the recommendations for pharmacists? Pharmacists should participate in drug therapy monitoring to recommend and recognize appropriate drug therapy. Pharmacists should stay abreast with the current state of knowledge through familiarity with literature, consultation with colleagues and other healthcare providers, participation in continuing professional education programs and other means. Pharmacists should make themselves available to prescribers and nurses to offer information and advice about therapeutic drug regimen and the correct use of medication. Pharmacists should be familiar with the medication ordering system and drug distribution policy. Pharmacists should never assume or guess the intent of concluding medication order. If there are any questions, the prescriber should be contacted prior to dispensing. When preparing drugs, pharmacists should maintain orderliness and cleanliness in the work area and perform one procedure at a time with a few interruptions as possible. Before dispensing a medication in a non-emergency situation, the pharmacist should review an original copy of the written medication order. Pharmacists should observe how medication are actually being used in patient care areas to ensure the dispensing and storage procedures that are followed and to assist the nurses in optimizing patient safety. Pharmacist staff should review medication that are returned to the department. Such review process may reveal breakdown or problems that have resulted in medication errors. Example, omitted dosage and unauthorized drug. Now moving further, when dispensing medication to ambulatory patients, example at this start, pharmacist should counsel patients or caregivers and verify that they understand why a medication was prescribed and dispensed, its intended use, any special precaution that might be observed, and other needed information. Pharmacists should review and provide advice on the content and design of pre-printed medication order form or sheet if they are used. Pharmacists should maintain records sufficient to enable identification of patients receiving an erroneous product. Infection control in hospital. But the development of written standards for hospital sanitization and aseptic, development of promulgation of procedures and techniques for meeting the standard and monitoring compliance with them, development and implementation for system for allocating, reporting and evaluating data concerning infection in hospital patients and personal population, development and implementation of review of system for using surveillance and review of antimicrobial within the hospital. Role of pharmacists in infection control. Hospital pharmacists have key role in hospital infection control. In meeting this obligation, they must actively participate in the affairs of the infection control committee, assure the microbial integrity of all products distributed by the pharmacy, particularly those required to be sterile, advise the hospital on the selection and use of appropriate antimicrobial drug disinfectant and sterile equipment. Establish and operate in coordination with the medical staff and ongoing antibiotic use review program for assessing and improving the quality of antibiotic therapy. Develop and conduct relevant continuity education program for hospital staff concerning antimicrobial drug product and their use. Encourage the single use of single dose packages of sterile drug in place of multiple dose containers. Work in the microbiology laboratory to improve microbial sensitivity, cleaning tests, and reporting of the results. Thank you.